Hi everyone. Today in this video let us discuss one of the medication Fospropofol. Fospropofol is a sedative hypnotic agent. It is available as its salt disodium. For the patients undergoing diagnostic and therapeutic procedures, it can be used for inducing monitored anesthesia care sedation. It is used in adults only and it is given by intravenous route as bolus injection. Supplementary oxygen is required while using Fospropofol. Fospropofol disodium is a prodrug of propofol. Therefore, the sedative properties attributed to the action of propofol. However, it differs with propofol in many aspects. Fospropofol requires less frequent dosing and it has fast recovery. It is water soluble. However, it is used only in adults aged above 18 years. So in this video, let's discuss all such important facts about Fospropofol. How does it work? Fospropofol is going to be metabolized to propofol by alkaline phosphatases. For every millimole of Fospropofol disodium, 1 millimole of propofol is going to be produced. Therefore, 1.86 mg of Fospropofol is equivalent to 1 mg of propofol. Propofol binds to GABA-A receptors, which are inotropic receptors coupled with chloride channels. When these receptors are activated, they open chloride channels, leading to hyperpolarization. This inhibits postsynaptic neurons, leading to sedation and anesthesia. Propofol also has other actions. It can also inhibit NMDA receptors. It can also modify the calcium influx, thereby it can reduce the excitation of neurons. It shows sedative as well as amnesic effects, but it is not having any analgesic effects. Peak plasma levels of propofol can be observed after 8 minutes of administration of Fospropofol. How it is given? Fospropofol is available as a single-use vial. The solution for intravenous administration contains 35 mg of Fospropofol disodium per each ml. A single dose administration is sufficient to induce the sedation. However, in a few people, based on the requirement and the level of sedation, a supplemental dose may be given. But before giving the supplemental dose, the patient should demonstrate purposeful movements in response to either verbal or light tactile stimulation. The supplemental dose should be used at lowest amount possible. The standard dosing regimen of propofol for inducing sedation is an initial intravenous bolus administration of 6.5 mg per kg. The initial dose should not be exceed 16.5 ml. Suppose a patient is having a body weight of around 90 kg, then the dose will be 16.5 ml. This is the maximum dose. So whatever may be the body weight of the patient, the Fospropofol should be given not greater than 16.5 ml initially. If required, supplemental dose can be given at a rate of 1.6 mg per kg based on the desired level of sedation. Normally, the supplemental dose is given at around 25% of the standard dose. However, it may be variable based on the weight of the patient and other factors. Similarly, the supplemental dose should not exceed 4 ml. In the elders with an age of above 65 years, a modified dosing regimen should be used. For people with severe systemic disease, again this regimen can be followed. It involves around 75% of the dosing regimen, so it can be started at 8.5 ml initially and the maximum dose is 12.5 ml. The supplementary dose may be given at a minimum of 2 ml to a maximum of 3 ml. Fospropofol has a low volume of distribution, whereas liberated propofol has large volume of distribution. Both Fospropofol and propofol are highly protein bound. Fospropofol is metabolized by alkaline phosphatases to propofol along with two metabolites, formaldehyde and phosphate. Now let us see the side effects of this medication. Mainly, Fospropofol can produce respiratory depression, hypoxemia, and loss of purposeful responsiveness. Other side effects like hypotension, paresthesias, and pruritus can also be observed. Even it can also produce cough in the people. Now let us see the precautions of this medication. Fospropofol may cause loss of spontaneous respiration. Apnea can be observed with both standard or modified dosing regimens. It can be more pronounced if it is used at a dose higher than recommended. Supplemental oxygen is required while receiving Fospropofol. The dose of propofol should be individualized to each patient and it should be properly titrated to produce a better effect without inducing apnea in the people. In the elders age above 65 years or in those people who have severe systemic disease, Fospropofol should be used at lower doses possible. Any other medications like narcotic analgesics or hypnotic agents that are simultaneously used with Fospropofol may have an effect on heart as well as respiratory system. Therefore, all these factors should be considered while using this medication. Fospropofol can produce hypoxemia, which can be detected by pulse oximetry. Hypoxemia can be observed even in the people who have the ability to respond purposefully during sedation. Therefore, retention of purposeful responsiveness may not prevent the development of hypoxemia. This condition can be minimized by using supplemental oxygen as well as appropriate positioning of the patient. On the administration of Fospropofol, the patient may not respond to vigorous tactile or painful stimulation. This may be observed for a time period ranging from 2 to 16 minutes. Fospropofol may produce hypotension. Patients with reduced vascular tone, myocardial dysfunction, or reduced intravascular volume may have an increased risk. This medication can cause cardiorespiratory depression. In case of overdose, it should be immediately discontinued, and respiratory depression may need either manual or mechanical ventilation. Formate and phosphate are the two metabolites of Fospropofol that may lead to toxicity in overdoses. This may lead to metabolic acidosis, hypocalcemia, muscle spasms, and even seizures. Therefore, in case of toxicity, Fospropofol should be immediately discontinued and a manual or mechanical ventilation should be arranged. So that's all about the different facts of Fospropofol, which is a prodrug of propofol, but it has few advantages like it needs less frequent dosing, it is water soluble, and it has less side effects compared with propofol. However, this medication is suitable only in the adults with age above or equal to 18 years. This medication needs supplementary oxygen in order to avoid any hypoxemia and respiratory depression. So that's all about this medication, Fospropofol. I hope this video is useful to you. If you really like this video, please subscribe to our channel and hit the like button. Post your comments in the comment box. Thank you for watching. See you in the next video.